It's week 3. We'll be covering inflammation and immunity. And because immunity is going to, sorry, I'm phrasing this poorly. Okay, inflammation, immunity, autoimmune disorders, HIV, because that's a human immunodeficiency virus. And then we'll kind of go back into order with alterations in blood pressure, cardiac function, heart failure, and dysrhythmia. So it is out of order compared to how the book had it, just to space things out and space out the pathophysiology a little bit more. So we'll start with infectious and inflammatory. And again, our tests in this class are not cumulative, but we're going to keep seeing infectious and inflammatory disorders for the rest of our careers, right? So understanding this is just very, very fundamental. And I believe we've already seen something along these lines. The chain of infection, the transmission of infection is relying on several different events. So in order for transmission of an infectious thing to occur, there needs to first of all be a reservoir for that thing. The reservoir could be an infected human. It could be an infected body of water that's carrying a pathogen, an animal. It could be in the soil. That would be our reservoir. There needs to be a portal of exit so that infected human may sneeze, and those mucus droplets are going to be the thing that contains the pathogen for infection. So again, nasal droplets, an insect bite, semen if we're talking about a sexually transmitted infection. There has to be a portal of entry into the new host, the victim of this pathogen. So a mucous membrane would be a great way to do that. If there's, let's say, the epithelial barrier, your skin is punctured or damaged in some way, that's a great portal of entry for a lot of pathogens. And of course, a susceptible victim, we talked about in our etiology discussion how a lot of things would not take hold in a perfectly healthy, perfectly wealthy, perfectly protected host, right? It's environmental stressors that make us more susceptible to contracting diseases. Because we have all of these locations in which we can transmit disease, or all of these links in a chain that have to occur, that means we can break this chain at any time. And I used to have this on a worksheet, and I would say, okay, show me an example of how you could break this chain at each level. And one clever, overly clever or under clever student just wrote hand washing at every single one of these. And they weren't wrong. So obviously hand washing is going to be a big one for basically all of this. But of course you can do other things. If it's in water or soil, you can treat water, you can treat soil. If you're blocking portals of exit, if you were the sick one, you could wear a surgical mask and prevent nasal droplets, mucus droplets from getting into the air. If you were a carrier for an STI, wearing condoms would prevent the portal of exit. And again, that method of transmission, you can block that. You can block your portal of entry. If everybody else is sick, it's flu season, you can wear a surgical mask and prevent that from getting into your face in the first place. I really wish culturally we had a tradition of just wearing surgical masks like in Japan. Like I would very much prefer that if that was just normal. It's not normal. People think I'm weird if I come to class like covering my face because I'm sick and I don't want to get my students sick. It should just be normal if we want to prevent disease. Of course, hand washing is going to help prevent you moving your infected hand up to your face and your mucous membranes of your face. And then, of course, reducing the victim's susceptibility. If everybody were healthy and wealthy and wise, we would not have as many vulnerable hosts. And of course, that's a societal issue that is probably not going to happen anytime soon. And of course, hand washing, yes, it's going to break this chain in a lot of different places. So remember that you have an innate immune system. You have a lot of things that are going to protect you from infections regardless. It's not about specificity. So even things like your skin, your epithelial barrier, separating the inside of you from the outside of you, that's innate immunity. You can have bacteria on your skin, as long as they're not getting into your skin, you're going to be fine, right? You also have cells that participate in your innate immune response, things like neutrophils that are nonspecific They're just going to show up if you cut your skin, and they're going to consume anything that they see there. You can also develop a specific immune response, and that's going to be based mostly on your lymphocytes and your antibody production. So that's our immunology review content, and we already covered it, so we're going to leave it there. Do you guys feel comfortable with that or anything? Okay. Remember, your specific immune response, it's slow to develop. It will activate on your second exposure to a pathogen, not on your first exposure. Which is why we have immunizations. And immunization is a way of exposing you to a pathogen, but that pathogen has been weakened or it's just part of a pathogen. So let's go a little bit into detail on this because this is a really important concept. So what a vaccine is, when we develop a new vaccine, let's say against a virus, because that's kind of the wheelhouse for immunizations. Remember, a virus is not a cell. A virus is a combination of protein and nucleic acids, right? It doesn't have all of the macromolecules of life. So what that vaccine is going to be, it's still going to have or be an antigen. It's still going to be something we can identify as other, right? So we'll take that vaccine. One thing that we could do is we could remove the nucleic acids from that, or from that virus. And now that virus, the protein is there, the thing that we can identify as other is there, but it can't inject its genetic material into your cells, so it can't hijack them. Or if there's just a part of the virus that we recognize as the antigen, we may physically remove the antigen and put that in the vaccination. Right? There's different levels of vaccine. Some of them are more effective. The most effective would be a weakened form of the virus. Right? Those are the ones you get the shot once, you're immune for life. If they just took an antigen out, that's going to be a weaker virus that's going to need booster shots. And that's the concept that'll come back to you. Other people are going to describe it in more detail, what all these different vaccinations are. I just think it's important to get a foundation here because we do have the anti-vax community not understanding the fundamentals of what a vaccine is. And again, we're not going to approach anti-vaxxers with any hostility. We're going to assume that they are afraid for their children and they're trying to protect their children just like everybody else, and they just don't have all of the information. That's my personal approach. If you come at somebody saying that they're an idiot for believing what they believe, they're going to shut you out, and they're probably going to stop getting health care altogether for them and possibly their child. So we want them to continue getting health care, and we want to show them some basic decency and respect. And that's the approach I recommend for that. Education, right? Know what a vaccine is and be able to tell them. So now you've been exposed to an antigen, and so your body has been able to create antibodies. So if you actually do get exposed to that virus, now you have prior exposure, and your specific immune system can mount an immediate response despite you never having been sick with that disease before. And that's excellent. There's no downside. That also kind of explains why some people get a mild fever in response to vaccines. That's again another anti-vaxxer position is, well, I got sick because I got the vaccine, right? You didn't get sick, you had a mild fever because you had an immune response to an antigen. Your immune response isn't always necessarily about the harm being done, it's about the presence of something identified as other. Making sense? Okay. And we already talked about the role of the environment, how sanitation, air quality, living conditions, and climate, just being healthy and wealthy, really, is going to play a major role in your susceptibility. As you can see, it's also going to be about that phrase I'm looking for, the reservoir. If things are sanitary, then there aren't going to be reservoirs for diseases. A lot of infections are opportunistic. If you're stressed out, if you have a weakened immune system for some reason, whether it be an immunodeficiency or medications that suppress your immune system, or just a state of stress where cortisol is high and suppressing your inflammation response, that would make you vulnerable to opportunistic infections. Okay. Anytime there is a pathogen or even just any kind of pro-inflammatory event, an injury, for example, there will be an inflammation reaction. And inflammation is a complex cascade. And we're going to have to understand inflammation to a pretty deep level. Inflammation is purposeful. It has a reason, right? In some ways, inflammation is good because it brings white blood cells around. It brings nutrients to the site of injury. It brings all of the things to the tissue that can fight the pathogen, repair the tissues. That's what it's supposed to be about. Unfortunately, what we're going to learn about inflammation is that inflammatory event, usually it's a bit too much. Inflammation causes its own pain. Inflammation in some cases can cause its own damage, right? So here's our sort of starting point for inflammation. One of the first things that happens is vasodilation. Our blood vessels are actually going to dilate, and that dilation of the capillary bed, first of all, it increases blood flow, so we get more blood cells, we get more white blood cells in the area. It's actually also going to increase capillary permeability. Remember, we've got 3 types of capillary beds: continuous, fenestrated, and sinusoidal, right? Most places are continuous. So an inflammation reaction is actually going to create more space between those endothelial cells, and things are going to leak out of those spaces during an inflammation reaction. So fluid, plasma, is going to leak out. What's a really, really important plasma protein? Name some plasma proteins. Albumin is in there, exerting osmotic pressure. So in this case, absolutely, albumin is going to be leaked out of this capillary bed. We're going to have, you have a question? Yes. Yeah, we'll see this cascade in more detail in just a minute too. So the increased blood flow is causing heat and redness. The release of fluid is causing redness. It's going to cause edema, like you say. Yeah. We're going to have chemical attraction of white blood cells. We're going to talk about diapedesis, chemotaxis, and pavementing in just a minute. These are just physical ways in which white blood cells migrate from the capillary bed out into tissues. And that's chemical attraction. And then a systemic response, there'll be a fever, a proliferation of white blood cells. You're actually going to generate more white blood cells in response to this inflammatory event. And that leads to the 5 cardinal signs of inflammation: heat, redness, tenderness, swelling, and pain. So again, these are a response to inflammation. These are because of inflammation. This is not the virus causing heat, redness, tenderness, swelling, pain. It's not the bacterium causing heat, redness, tenderness, swelling, pain. It's your body's response to that thing that is causing the inflammation and those 5 cardinal signs. In severe conditions that are inflammatory, there can be a loss of function. If you have these cardinal signs across a joint, you may lose range of motion, for example. This could be, of course, anywhere: intestinal, you could be in any tissue anywhere, and you could have loss of function in that tissue as a result of the inflammatory response. So here's a more detailed cascade. In fact, these 2 are going to interact with each other, and I do have these on your worksheet today. And I want to show you, I'm going to kind of break them down in a way where they interact with each other. So the tissue is damaged: physical, chemical, mechanical, pathological, whatever. That tissue itself is releasing vasoactive and chemotactic factors. So chemotactic factors, chemotaxis, is defined as a chemical signal. It's a chemical signal that attracts white blood cells. Chemotaxis is a white blood cell moving towards that chemical signal. So a chemotactic factor is going to be anything released by cells, living or dead, probably dead, that invite more white blood cells, that attract them. And then vasoactive, of course, is going to be chemical signals that cause vasodilation, that cause that leaky blood vessel. So we get vasodilation, increased permeability of the capillary bed, neutrophil emigration. And again, that gets us our signs. Let's go back to this one. We're kind of showing some of the same things here. We had an injury at the start of it. Those vasoactive chemicals. Chemokines, again, this is just another way of saying chemical signals. We've got a lot of things that if you can just mentally clump into the category of chemical signaling molecules. Some of these things like chemokines, they just came from damaged cells. There's stuff inside the cell, and it's supposed to be inside the cell. When you destroyed the cell, now that stuff is outside the cell. And some of that stuff will act like a chemokine and will be pro-inflammatory. Yes? Mm-hmm. Yeah.
So if I'm understanding this correctly, like if you have a pinched brachial nerve plexus, that's going to cause spasming of the muscles and then inflammation, which will then cause your arm to lose range of motion, and then
not necessarily. So if you pinch your brachial plexus, that's going to be a nerve impingement. That's not necessarily going to be inflammatory. That's going to be nerve function. Right. As I understand it. But if you had, let's say, tendonitis in your wrist, that would.
Not as severe.
Mm-hmm. Yeah. So it wouldn't be a deficit of the nerve in that case. It would be a deficit of inflammation causing problems with range of motion and strength in the muscle, because the inflammation would be in the muscle in that case. Okay. Again, this pathway is just specific to how we get white blood cells to an area. We'll talk about pavementing in a second. We will have the white blood cells circulating through the capillary bed, and when in the presence of these chemokines, they're going to start binding to the epithelium and being pulled through the epithelium. And we'll see what that looks like in just a minute. It's pretty great, actually. So I would really like for you to sort of mentally integrate these two concepts. When we get our sort of neutrophil emigration over here, we're kind of talking about this cascade over here. A neutrophil just being one type of white blood cell, obviously, but it is the most common white blood cell. And it's always going to be there for any injury you get. So again, those white blood cells are there to phagocytize. They're there to consume any pathogens they find in their path. It's an innate immune response, so these are just neutrophils, maybe some monocytes. Neutrophils can also secrete proteolytic enzymes, lytic enzymes, things that break things down, right? You guys remember that about neutrophils? They release enzymes. Aside from phagocytosis, they also have this mechanism of lytic enzymes. That's also going to cause a potential problem for us, because think about what neutrophils are. You're very abundant. They're first responders. They show up at all your injury sites. Let's say there are some bacteria around and they're releasing a bunch of lytic enzymes. Are those lytic enzymes only going to attack the bacteria? No, they can start to break down your own tissue. And they will break down your own tissue if that's the mechanism they're using. You've got some lab tests right here for testing for systemic manifestations of inflammation, acute phase proteins, and erythrocyte sedimentation rate. Sedimentation just means heavy things drift to the bottom. Now again, inflammation's occurring whether the source of damage was exogenous or endogenous. Did we do something to ourselves? Was something done to us? Was it a bacterium or was there something internal? There are some just entirely, for example, autoimmune events that have nothing to do with outside damage. It's our own damage. And of course, itis is the suffix attached to inflammatory conditions. Esophagitis, tendinitis, etc. So again, we kind of clump infectious and inflammatory, but you can have inflammatory without infectious. Most infectious things will lead to inflammatory, but not necessarily the other way around. I'll go on a little bit longer. I think I'll stop at exudates. And an inflammation response can be very short term. It can be acute, less than 2 weeks. But of course, if it sticks around, if it persists, it can become chronic. That will tend to be more systemic and diffuse, obviously over longer periods. Our body's response to that, very often, we're going to see this concept of granuloma formation. A granuloma means we can't clear the infectious thing. We can't get rid of it. So we're going to surround it completely. What we're looking at over here is there's some kind of pathogen in the middle here, and we've completely surrounded it by white blood cells. Yes? Mm-hmm. Absolutely. Tuberculosis is an example of this, where you're going to have our white blood cells completely cordoning off that infectious agent. But of course, that's going to make a sort of tumor, right? Oma means tumor. It's benign, or it should be benign, right? But it's going to be a growth. And anytime you have a growth, that's non-functional tissue. So in the case of tuberculosis, you're going to have all of these granulomas in your lungs that are not functioning lung tissue. And that's one way in which it can result in scar tissue and deformity. Here's pavementing. So here's an inflammatory event is happening within the tissue, and that inflammatory event has released cytokines. Here's the endothelium of the capillary bed. We've got a simple squamous epithelium. And one thing we've just never mentioned about this epithelium, but is true for all cells ever, is they have plasma proteins embedded in them, right? That's just a basic cell principle, is there's plasma proteins. These plasma proteins, in the presence of cytokines, are actually going to extend and bind to proteins located on white blood cells. So what's happening to this white blood cell is it'll start binding. Its movement through the bloodstream will be slowed by this binding, and ultimately these proteins are going to physically pull it through the capillary endothelium. Remember, we've got increased vascular permeability so that this is more plausible. And now this white blood cell, this looks like a neutrophil that's been illustrated, is out in the tissue instead of in the capillary bed. So I always kind of imagine it like you're walking along and then it's like swampy and then you just get sucked down into the upside down. And that's kind of what's happening to this white blood cell over here, if you're a Stranger Things fan. If you're not a Stranger Things fan, maybe that scene in the labyrinth with the hands. Yeah, the Scooby-Doo episode probably, yeah. Okay. When you have exudates, that exudate is about, again, that's your body made that exudate. It's not the virus or the pathogen made that exudate. You made the exudate. It's made out of plasma. It's made out of proteins. It's made out of white blood cells. It's made out of the nutrients that were in your bloodstream. Now they're in this tissue trying to help you. It's fluid that leaks out of blood vessels, along with neutrophils and some debris from phagocytosis. Their cleanup crew is there trying to clean things up. I think that's where I want to stop for your first break.